People who have diabetes are twice as likely to have a heart attack or stroke. Heart disease is the leading cause of death in men and women in the United States. What else increases my risk for heart disease? Besides having diabetes, other risk factors include high blood pressure, high cholesterol, smoking, obesity, poor eating habits, physical inactivity, and excessive alcohol intake. Heart disease is the buildup of cholesterol in the inner linings of an artery. This buildup is called plaque, and it reduces the amount of blood and oxygen that is delivered to important organs, especially your heart. The two most common complications are heart attacks or stroke. The medical term is atherosclerotic cardiovascular disease, or ASCVD. What can I do to prevent developing heart disease if I have diabetes? Learn the ABCs of diabetes. A stands for A1C. For most people, the goal for ideal diabetes control is having an A1C less than 7%. You should have this checked every 3 to 6 months. Talk with your healthcare provider about your specific goal and how often you should have it checked. B stands for blood pressure. High blood pressure can put unnecessary strain on your blood vessels and cause damage. For most people with diabetes, the blood pressure goal is less than 140/90. For people with diabetes and at least one additional risk factor, the blood pressure goal is less than 130/80. C stands for cholesterol. Too much cholesterol can build up in your arteries and lead to heart disease. Be familiar with the different type of cholesterol. LDL, or bad cholesterol, contributes to fatty buildup in your arteries. Although the lower the better for LDL cholesterol goals is true, there is no set goal for the general population. It can depend on several things, especially your other risk factors. Talk with your healthcare provider about your personal cholesterol goals. HDL, or good cholesterol, acts as a scavenger, carrying the LDL cholesterol away from the arteries. A healthy HDL level can be protective against heart disease. Triglycerides. These are a type of fat found in your blood. Sometimes if your blood sugars are elevated, your triglycerides will be as well. The goal for triglycerides is 150 or less. Talk with your healthcare provider about your personal cholesterol goals. How can I reach my goal through a healthy lifestyle? Eat a heart-healthy diet. Include lots of fruits and vegetables, as well as whole grains. Choose lean chicken and fish over red meat. Increase healthy plant-based fats, and choose olive oil over butter. Eat less salt. Don't put extra salt on your food while cooking or after it's prepared. Experiment with herbs and spices to flavor your food instead of salt. Be active. Aim for 150 minutes of exercise, with 3 days of physical activity and 2 days of resistance training. Keep your weight in check. Talk with your healthcare provider about your BMI, or body mass index. A sustained weight loss of 7% of your body weight is ideal. Stop smoking. 1 year after stopping smoking can cut your heart disease risk by 50%. Manage your stress. Use stress management such as yoga or meditation. Check in with your healthcare provider on a regular basis. Take your medications as prescribed. What if I need medicine? Sometimes you will need medicine to help meet your goals. Statins. Medicines that help reduce your LDL or bad cholesterol. Most people with diabetes over the age of 40 will benefit from a statin. Aspirin. Lessens the ability for your body to make blood clots. Talk with your healthcare provider to see if you need an aspirin. ACE inhibitor and ARBs. These are 2 medicines that can lower blood pressure and protect your kidneys. These medicines are similar and should never be taken together. Talk to your healthcare provider if you have questions about any of these medicines. Diabetes medicines. Certain diabetes medicines have been proven to keep your heart healthier. Talk with your doctor about these. Remember, if you have diabetes, you need to understand the important link between diabetes and heart disease. You also need to be an active participant in your own care. Always discuss your treatment options and healthy lifestyle goals with your healthcare provider.